Objective gait analysis and equine lameness assessments. When a horse is brought to the vet for a suspected lameness issue, one obvious challenge arises. You can't ask the horse where it's feeling pain and expect an answer. Since horses can't communicate verbally, they rely on veterinarians to interpret. Part of the veterinarian's task is to observe the horse's movement for clues as to which limb or limbs might be causing pain. It's no small feat. As part of this important, subjective examination of the horse's locomotion, it is also possible to objectively measure and quantify the movement using gait analysis technology. For example, using SLAPE to record and analyze a video of the horse. But why would you want to incorporate objective gait analysis during a lameness exam? What additional value does it actually bring? A quick analogy. Consider the fever thermometer. Even if you can detect a fever by looking at someone or feeling their forehead, the quantified measurements are useful. Scientific literature generally raises three main points as to why objective gait analysis is particularly useful in lameness exams. Let's explore. The first is biological limitations. The human eye struggles to perceive fast movements accurately. A prime example of this can be found in the early history of equine biomechanics. In the late 1800s, a man named Edward Muybridge carried out an ambitious project to photograph horses trotting and galloping. His goal was to secure proof that during these gaits, there are brief moments when all four of the horse's hooves are off the ground. Prior to his work, no one knew if this was the case, as the movements of a horse's limbs were too rapid for the human eye to perceive accurately. The second point that is often brought up as a reason to use objective gait analysis tools is also a biological limitation, but this one is related to the human brain. It is called expectation bias, a psychological phenomenon whereby our expectations skew our interpretations of results. For instance, research has shown that veterinarians looking at videos of horses and grading lameness severity tended to perceive it as more severe if they were also told about a prior treatment in a limb. All humans, in all areas of life, are prone to expectation bias. The third argument for adding objective gait analysis to the lameness assessment toolbox is a consequence of these biological limitations. Anyone familiar with horses will likely have heard the saying that if you take your horse to 4 different vets, it will be lame in 4 different legs. This joke holds some truth, especially in cases of low-grade lameness. When the lameness is subtle, even experienced clinicians have difficulty agreeing on which limb is affected. No matter how experienced and skilled a vet is, we need to understand that it is physically impossible for the human visual system to track and process all the relevant points on the body of a trotting horse. Objective gait analysis cannot replace the subjective evaluation in lameness assessment, just as the fever thermometer cannot replace the physician. The measurements from gait analysis tools are valuable, but only when paired with the expertise of the vet and in the full context of the lameness exam. Detecting asymmetries is just one piece of a complex diagnostic puzzle. There are additional upsides to making objective gait analysis a part of the clinical lameness exam: quality documentation and communication, supports dialogue between clinician and horse owner, facilitates consultation with colleagues, supports education and training. Visit our website to learn more about objective gait analysis and the SLAPE app.